At this time in the global pandemic, we all have a role to play to protect ourselves, our patients, and our loved ones.
We need to be role models and we need to help and support each other.
And we need to make sure that we wear the correct PPE, we wear it properly, and we dispose of it as we should.
Please do not come to work or leave work in your uniform. Please get changed at work, put your uniform into a clean bag and take it home with you to launder once you get home.
We need to wear the correct PPE in all areas of all our hospitals and follow the correct guidelines.
In our corridors, please do keep to the left and do not walk too closely together with colleagues. Please maintain social distancing in all public areas and in the clinical areas if possible as well.
Please don't eat in corridors or public areas. Use the designated areas that have been provided.
It is just important to follow guidelines when taking off your PPE to avoid contamination.
So don't rush, take your time with it.
When disposing of your PPE, please use the correct bins. If they are full, please do not just throw it on top and walk away. Let someone know the bin is full so it can be emptied.
If the scrubs bin is full, please take another bag and use that. It is your responsibility to dispose of them tidily and do not leave them on the floor for somebody else to tidy up after you.
For patient care, it's important that we wear the correct PPE. For instance, in the cardiac catheter lab for primary PCI, which is potentially aerosol generating, we wear a visor and an FFP3 face mask. This will be different on the ward, and if you're unsure, then please ask.
Take your time. PPE is really important. It's the most important thing you'll do all day, so get it right.
It's okay to say to a colleague we're not doing it correctly, no matter who it is. We can all forget, so you're helping them by telling them, don't worry about who it is. They'll understand how important it is and you're only looking out for their well-being.
Infection prevention is all of our business, whether we're clinical or not. The COVID-19 Toolkit, available online, is a great resource.
These are such simple actions to take to help avoid the spread of coronavirus, so please take 10 minutes to watch our videos and remind yourselves of our guidelines.
You must complete your infection control training online. Everyone with a clinical role must do this. Details are available on the intranet.
It really is important that our infection prevention training is up to date. Since the beginning of COVID, lots has changed, and so what we need to do has changed too. The only way that we can keep ourselves and our patients safe is to be up to date with all the current practices around infection prevention. If you're not sure, please ask your line manager to support you getting the training you need, or have a look at our website where there are lots of resources. Everyone has a role to play in infection prevention. What's yours?